My name is Rasheed. I'm a physiotherapist by background. And currently I'm working as the Director of Clinical Services.
In what kind of unit?
It's a place where we provide rehabilitation and long-term care for people with disorders of consciousness, or patients who need long-term ventilation, and patients who come here for slow-stream rehab after different types of neurological problems.
And in your role as clinical director, what is it you do for cdoc patients?
Most of my role currently is managerial, where there is less and less patient contact. I lead the clinical governance committee, where the main focus is continuously improving the quality of care and treatment provided to patients. So there is a big focus there on how to improve things for the patients and for the families as well. How do we support them?
So you provide leadership in both those areas. So if I start with the first one about staff, how do you, as a clinical manager, support or manage staff, particularly when they're working with DOC patients? What are the challenges?
There are quite a lot of challenges. First one will be emotional, because every patient in a disorder of consciousness has a tragedy behind them. So there is an emotional element involved with the staff working with them on a daily basis and for a prolonged basis as well. So first one is we start preparing our staff for this type of emotionally challenging work from day one. So for example, we would touch these topics at interview and at induction as well. And we want to make sure that the staff are comfortable doing such sort of work, and they will cope with the emotional challenge this work brings.
So an interview and induction, and then do you do any kind of, during the course of the year, is there any review or support for staff around working with?
We do. We also have the regular support meetings for staff. So for example, when a new staff member starts, they go through 2 weeks of induction. They have a 6-week review with their line manager. Then they have a 3-month review, at which time their role will be confirmed and they will complete their probation, and some objectives will be set for that staff member for the next 6 to 9 months. And then it is followed up by annual appraisal program. But aside from this line management route, there is also a clinical supervision route in which all our clinical staff are part of a small cluster of 5 to 6 members who are all in a very similar role. So for example, there may be 5 healthcare assistants who will have one clinical supervisor who might be a registered nurse. And they meet roughly on a quarterly basis as part of their clinical supervision program, where they discuss complex case studies or difficulties they are having.